During the course of a meeting with staff members of the primary care centre and the union, they expressed a concern that on various occasions there have been instances of members of the public threatening the staff and also shouting abuse at them. Unfortunately, there was one case where a member of the public took hold of a computer screen and threatened to throw it at the staff. Thankfully, there have not actually been any instances of actual physical violence visited on our staff, but I took the concerns expressed by the staff extremely seriously. Certainly, if I worked in any public location and I was at any point during the course of the day threatened or abused or an object were to be held to be thrown in my direction, I certainly would be in fear and certainly would be asking management to introduce safety features. But it's not just that we've introduced safety features in isolation. We've also made sure that the reasons why persons may be complaining about the appointment system, for instance, has been improved. In this particular case, we've now ensured that there are increased daily appointments available at the counter and not just when people call in by phone.
Well, you say there's been a decrease in incidents since the appointment system has been revised further. This, of course, at the heart of many of the incidents. So do you accept, though, that the system still needs addressing and it's somewhat flawed?
It has to be remembered that the appointment system has very much been improved by my colleague Dr. John Cortes since he came in as Minister for Health. Before, appointments were very, very difficult, and the system was changed to have appointments done monthly and then eventually to be able to obtain appointments daily. And what I inherited from my colleague John is a far cry and a damn sight better system that we had when we inherited. So is there room for improvement? Absolutely there is, and I think that the key will be in ensuring that we make better use of technology, because one of the staggering statistics that I found out when I became Minister for Health is that there are 55,000 calls logged at the primary care centre a month. And also that there's an average of 450 people, 450, who do not turn up to the appointments. Now, if the primary care centre is used rightly as it should by the public as much as it is, but if members of the public do not turn up to those appointments, all that does is affect and prejudice other persons who were seeking appointments but were unable to attend the preferred doctor because the person who did not turn up did not cancel beforehand. So with the GHA management and the primary care centre manager, we are looking currently and actively on how we better integrate technology, on how we make sure that there is a system that is foolproof so that a person who cannot attend is able to cancel, so the GHA is able to use that cancelled appointment for somebody who seeks an appointment on that same day.
So what type of changes can we expect, and would more draconian measures perhaps need to be put in place to ensure that people actually turn up to their appointments?
Well, certainly one of the things that has been put to me by the PCC manager is that if there are persons who do not turn up to 3 or 4 consecutive appointments, there certainly should be a consideration to determine how best to deal with persons who book appointments but then do not turn up. But that is something that is very much under active consideration. And one of the things I would certainly have to say is that there could not be any system of sanction unless there is a foolproof system where a person who does not turn up is able to cancel that appointment. If such a system were to exist, and it's easy to cancel the appointment by email or by telephone or any other means, and that person being able to cancel the appointment fails to do so for a consecutive number of times, then certainly that is something that we need to carefully consider.